Monday Health Minutes, sponsored by Valley Health.
I'm Melanie Schaefer. This is Valley Health Minutes. There's hardly a family these days that hasn't been touched by autism, and so today we're talking with Dr. Oxley, a clinical psychologist specializing in pediatrics, about autism spectrum disorder. Thanks so much for being here.
Absolutely.
What can you tell us? What is the definition of autism spectrum disorder?
So autism spectrum disorder is a lifelong disorder. It's in that group where we would call it, again, a neurodevelopmental disorder, where it's speaking on inherited changes of differences in that person's brain functioning and development. It's usually characterized by a core of symptoms that often presents early on in a child's life. And those core symptoms are really focusing on language acquisition, social communication, how they interact with their social world, and then a core set of behaviors of restricted interest and repetitive behaviors.
So what is some of the things that parents can watch for? It is a spectrum, so there's a wide variety of things they could be watching for.
And I think that's a great point, because the word spectrum and the sort of really does highlight how much variability these kids can have. Not one kid with autism is like the other, and I think really it speaks to the uniqueness of these kids. But when they're looking for signs and symptoms, I think that really, too, you have to lean on that variability, that when you're early on versus later on in childhood or even adolescence, it's going to look a little bit different. But when we're talking early on in the lifespan, you're really looking at how that child is communicating in the world around them. So what their language development is looking like, how they're interacting with their caregivers, and if there's any siblings or peers. Really looking at their level of interest of, like, are they referencing them? Do they care that they're there? How are they using their communication? Is it directed towards that person? Are they kind of playing in a way that is interactive, or are they kind of playing a way that's on their own? And is that play even considered typical? So, we expect most children that they're playing with blocks to be building those castles, those towers, but maybe they might be doing some sort of organization or sorting them or lining them up. If they're playing with action figures, are they making those stories? Are they making all those sounds and interacting? And are they more just, again, putting them in certain places and not really putting them in those story situations?
Or playing with cars, and instead of having them zoom, spinning the wheel repetitively.
Yes.
So those are all things that parents can watch for. If a parent starts to see that their child may not be typically playing as other siblings are or other peers are, at what point should they consider having their child tested?
Well, I think, when you're having those concerns, usually they're there because those differences are starting to mount up. You've seen that one here and there, and you've kind of kept an eye on it, and now there's more and more differences in terms of how they're interacting with their siblings, or how they're going about their day and how they're communicating. And I would say your first line of intervention is to really bring it up to your pediatrician, to kind of see, are those stages of development occurring at that right pace? Are they atypical for the period of that time with their child? And typically they're going to kind of refer them to us to kind of look for that further assessment. I think that's one of the uniquenesses about my position within Valley Health. I'm often in those centers right next to pediatricians, so if they have a family where they have these concerns, this is kind of where they can connect me to them, and we can talk about, do we need to get the testing, or are we kind of still in that typical?
If a parent would like to have their child looked at, maybe has some concerns that this might be part of what they're dealing with, what does the testing look like? How do they go ahead and pursue that appointment?
Yeah, so once they kind of get connected to a behavioral health provider that's doing testing, a lot of that testing is going to, again, focus on rolling out their cognitive impairment, making sure that they have, they're functioning appropriately from a cognitive standpoint, but also looking specifically at those behaviors that we would associate with autism. There's a set of tests that we typically give that's called the Autistic Diagnostic Observation Schedule, which is really key in putting these kids in an activity-based assessment one-on-one with us, where we're interacting them on a social level to kind of pull out some of those symptoms that we want to see, that we would expect to see for a child on the spectrum, so we can kind of guide on what's there, what's not, and kind of help better determine what that treatment plan should be going forward by the end of the assessment.
So sort of watching them play and how they play and how they interact with others, that gives you a clue as to what's next.
Yes, absolutely.
Dr. Oxley, thank you so much for giving us some information about this. A lot of parents have this top concern on their mind with their little people as they develop. We sure appreciate it.
Absolutely.
Thanks for being here for Valley Health Minutes. We'll see you next week.